Make lifestyle choices to enhance your well-being. This is Natural Inspirations. You are listening to Natural Inspirations Podcast, the show where we have conversations with local natural health experts on the Space and Treasure Coast. Welcome to episode 34. I'm Chris Urquhart. Today, we're talking to Dr. David Daly about PRP, your first line of defense for healing. Hi, Pam and Dr. Daly. Thank you so much for joining me today.
Hi.
Hi, how are you?
So we're talking today about PRP, and it's in the news a little bit. A lot of professional athletes are using PRP to help their joints and recover from injuries, but maybe we're hearing about it, but we don't know exactly what it is. So I'm hoping you can share with us and our listeners what is PRP, what's it stand for, and why is it becoming so popular?
Yeah, so PRP is popular and it's getting a little bit more mainstream because some professional athletes have used this therapy for their healing. But PRP is platelet rich plasma. And what that means is what we do is we take the person's blood and we put it in a centrifuge and we spin all the red and white blood cells out of the blood. So you're left with just the plasma, which is the liquid part of the blood. That in that plasma, there's cytokines, there's proteins, there's enzymes, there are electrolytes, everything that your body uses to fix itself, right? So we spin the red and white blood cells out and concentrate this golden brown liquid that's full of nutrients. And what we do is we take that and we inject that back into, say, a degenerative joint, a joint that's been injured. You can inject it into tendons, you can inject it into muscles. There's really nowhere that you can't inject PRP. They use it in eye surgeries, they use it in dentistry, so it's a pretty popular thing. And the reason why you can use it for so many different ailments and different tissue in your body is because you're using your own tissue, right? Your body's not going to reject it, which is super, super awesome. And it's a super safe procedure. And I think that's why a lot of like athletes and stuff use this therapy because there's really no downtime, right? Like, you know, there's not like a surgery, so there's not any scar tissue from the incisions. So you're just using your own blood to promote healing in whatever tissue that's injured or damaged.
So it sounds like it can work for so many things. I mean, what's a good example? If you've injured yourself, obviously the pro athletes are doing it, but maybe osteoarthritis or inflammation kinds of things, where would you inject it? How would that work?
So osteoarthritis is a really great one, like for degenerative changes. If you go to PubMed, there's tons and thousands of research papers. PRP is really good for inflammation. And so where could you inject it? Is that your question? Like you can inject it pretty much anywhere. And it's literally, I mean, like it's really funny to say, but it's literally great for everything, right? Like I wish I could, there's not any ailment or any disease process, like a musculoskeletal disease process that you wouldn't benefit from. So it's an all-encompassing natural healing modality. And literally you can inject it into joints everywhere.
So how does it work? Is it, if my joint hurts and I'm like, you know, I hurt my elbow, can you fix this? And you give me the injection. Am I going to feel better immediately, or does it take time?
You're probably not going to feel immediate relief. You're probably going to be a little bit more inflamed and sore actually at the site of injection or the joint, just because we are creating a little bit of inflammation. Right? You know, when you injure yourself, your body does have a natural ability to heal itself. And so that inflammation process of the healing is something that we want. And so with the PRP, we are increasing a little bit of stress to the joint. So that you need that. And most people are sore maybe for like a week afterwards. Everybody's different. Like, you know, I wish I could say, you know, everybody's body's so different. So I just really can't say, but I would say an average of our patients that we have, probably like a week, they're a little bit sore.
I think it depends too on what kind of injury, because if it's an injury that's been there for a while, I think it might take a little bit longer as versus somebody that was just injured. We followed several of our patients, and some of them have called back the next day or within 2 days, and they're like, oh my gosh, I I feel so much better.
Right.
Yeah. And we've had many patients for, like, we've done a lot of knees, a lot of hips and shoulders, and also just to soft tissue injuries also, like tendons, and people that have been in car accidents and injured their muscle and injured their tendons. So it's literally, like, like I said, it's so funny to say, but it's literally that good for any type of like injury. Like, it
So
works really well.
if you're spinning down the blood and then you said it's got stem cells and the good stuff, is it kind of a trigger for your body to say, hey,
I didn't say that it
healing
has
over
stem cells.
here?
It really doesn't have that many stem cells in there, like, because we're spinning some of that stuff out, and your blood doesn't have tons and tons of stem cells, especially as we get older. So the things that are in there that are actually going to help your body heal itself are the proteins, the cytokines, which are proteins that help with inflammation. There's electrolytes. So it's all that type of those nutrients that actually speed up the healing process. Just remember, blood carries all the nutrition that your body's going to use to fix itself, right?
Right.
Like, so if we can just spin your blood down and concentrate that food, that blood food or that plasma, and we're just going to saturate the damaged area with just a whole bunch of nutrients that your body's going to use anyway. We're just putting it right in the spot.
But does your body recognize that and say, oh, I need to do some healing here?
Oh, for sure.
And then does that take some time? I mean, you're saying everybody's different. So I guess is your body rebuilding tissue, I guess is my question. And
it is.
Does that take time?
That does take time, and your body is actually rebuilding tissue. That's a regenerative medicine, right? Like, regenerative means that you're actually building tissue. And so PRP is a great first line of defense for regenerative medicine. Unlike cortisone, cortisone is actually degenerative, right? So when you do a cortisone shot, you put that into your knee, you're only supposed to do 3 cortisone shots in a joint in a lifetime. And the reason that is because it's actually degenerative. It's actually breaking down your cartilage and breaking down the tissue.
So it seems like it's an opposite. Is it suppressing? Is it suppressing rather than encouraging?
Totally, right? But like a cortisone shot helps with inflammation, right? And so people notice most of the time in decrease in their inflammation, which will help with their pain, but it does nothing to regenerate anything. It actually degenerates. So yeah, cortisone is definitely not the first line of defense, like when you have something.
Just covering the symptom.
Yeah, right, masking everything, for sure.
You can be a much more natural bionic man. Yeah, that's what I'm thinking of, being able to last forever. We were kids, and I don't know.
Right, like I think,
mind how strong he was when he was older. Yeah.
Yeah, totally. I mean, like, it'll help for sure.
So have you had experience on this yourself?
I have.
Using it for maintenance so you don't grow old, or injuries, or what's been your experience?
So a couple of things. So I have had my knees injected and my penis injected with PRP. So I have 2 torn meniscuses in my left. Well, I have a torn meniscus in my left knee and my right knee. So that's how I just take care of my meniscuses, to kind of keep them as healthy as I can, to prevent surgeries. And I've had really great success. So I've used it in that way. I've used it in my penis just because I heard about this thing called the P shot, and I just wanted to try it.
Yeah, I just wanted to try it. But the intention of the P shot is for ED and
for ED, that's correct.
Mm-hmm. And there's one for women as well. It's called the O shot, and that's for vaginal rejuvenation, which a lot of women, especially as we get older, when they hit menopause or something along those lines,
dryness and just
elasticity.
Would it also be post childbirth?
I would say yes.
In my mind, when you said OSHA, that's where I went, was post childbirth repair.
I think it's rejuvenation. So obviously, it can work in any capacity. I know that Dr. Wu Daly, his wife did it as well, and she noticed incontinence. She didn't have not that she had a huge problem with it, but she realized that she wasn't having to, stop to sneeze or cough or something like that. So it wasn't a huge thing for her, but think about somebody that may have that issue.
Sure.
As we get older. So
and it will increase as you get older. Absolutely.
Absolutely. Right. So, the discovery of it is, it's nice to know that your doctors are actually using it, that they can actually tell you the experience.
Right.
I mean,
Right.
let's be honest, if they're not, oh yeah, I heard. No, they've done it. So we know that it works.
So I've had a lot of people like ask me like, like what, the procedure itself, just sounds kind of just like super crazy.
It sounds a little intimidating. I'm not going to lie. Yeah.
Yeah. But the one thing that I can say is that it just feels healthier.
There you go.
Everything feels healthier. Yeah.
Yeah.
Well, and that is motivating. Right?
Yeah.
We know males. So
Yeah. Yeah.
right.
So that's where I've used it. So I've used it on my dad's, we've done PRP on my dad, my mom's hip, my cousin's knee. So it's just one of those like first line of defense. Like that's where you want to go first before you do any pharmaceuticals and stuff like that, because it totally may change your life, how you
it could possibly avoid surgery as well.
Well, that's
depending
why
on the situation, obviously.
Yeah, that's why I'm using it, right? I'm using it to kind of keep my meniscuses, as healthy as they can. They're already torn a little bit, but if I can prevent them ripping anymore or tearing anymore, that's going to help. And then also if you have degenerative changes too, that's going to help the cartilage of the joint function a little bit better and last a little longer also.
I would presume that it's almost like anything. If you get ahead of it, maybe it's going to work a little better than if you wait too long and you've had more damage.
For
Probably
sure.
gonna take longer to come back. So first sign of a achy, squeaky knee, maybe.
Right. Or
Something
even
you want to look into.
Yeah, exactly. Or even if you don't even have any issues, like, I don't know, a lot of people aren't like, that progressive, but like, even if you don't have issues and you get PRP, yes, it's definitely would change. It would make a difference for sure.
Very interesting.
Mm-hmm.
Well, thank you so much for sharing all your knowledge and helping us get clear on what this PRP
Yeah, right.
newfangled thing is and how we can be naturally healthy. And I just want to emphasize one more time that, you're pulling it from our own body. So, I mean, how much safer can you get when you're injecting something back in it came from your own body. So no rejection, right? Or
none
side effects or any of that kind of thing.
No.
Yeah.
And like the only side effect that you get, like I said, you could be a little bit more sore, and we're okay with you being a little bit more inflamed. We're actually looking for that to be a little bit inflamed. Yeah.
It's a healing response, right?
Exactly.
Kind of like you just worked.
Yeah. We offer different therapies too that help after the PRP if, just to kind of keep making sure that you're just going to be healing at a good pace.
Yeah, that's a good point, because it's just not like a one shot and you're done. Like, you know what I'm saying? Like there is some therapy that we do. We do laser therapy. We do myofascial release, like Pam was saying, other things to help support PRP, right? And and if we can reestablish proper function of the joint, right, that's going to be really important also.
Yes, so you don't put yourself right back where you started.
Exactly.
Yeah, maybe you're doing something that got you into that spot to begin with. That makes sense.
Right.
Yeah. Well, thank you again. I really appreciate your time.
All right. Yeah, thank you.
It's a pleasure.
Thanks, Chris. Have a great day.
Yeah, you too.
And everyone listening, be well, stay connected.